Medicare, Medicaid, Medicare, Medicaid. You know, I've heard these two words for my entire adult life, but honestly, until recently, I have not understood what either of them do. Do you feel that way? Well, I've got good news because I just met two amazing people who can help us figure it out. Welcome, everyone, to Alaska Wisdom and Wellness. I'm Marty Lang.
And I'm Pat Branson.
And we're your hosts for the program. Alaska Wisdom and Wellness is a program designed especially for Alaskan elders and seniors, as well as those who are actively involved in their caregiving. As we grow older, there are often many questions and concerns that arise. Our goal is to address these issues and provide you with practical insights to make life easier. So whether you're listening in Ketchikan or Kaktovik, Utqiagvik or Unalaska, or somewhere in between, welcome to Alaska Wisdom and Wellness. On our show today, we have two special guests from the Medicare Information Office. They help people understand how Medicare and Medicaid work, and also how to sign up for it. Not only do they understand the ins and outs of Medicare and Medicaid, but they know how to explain it clearly in everyday language. An Alaska-sized welcome to both of you. Please tell us your names, your titles, and what you do with the Medicare Information Office.
My name is Janae Larson. I am a program coordinator for the state of Alaska Medicare Information Office. I'm also known as the lead Medicare counselor. So I spend a lot of my time at the Medicare office counseling people on Medicare, doing outreach in the community, Medicare educational events, both in person and on the computer by webinar. And I also am tasked at being the subject matter expert. So when our Medicare counselors or any of our network has really in-depth, really uncommon Medicare questions, I'm the person that they come to for that additional guidance. And I've been with the Medicare Information Office since 2006. So I'm the longest Medicare Information Office employee.
Wow.
Kind of the dinosaur of Medicare.
I would prefer to say the old wide sage.
So true.
And my name is Dana Norwood. I am the program coordinator too for the Medicare Information Office. So I oversee the office. I handle the state and federal grants which fund the office. I do Medicare counseling during our busy time of year during open enrollment for the most part, and a lot of outreach and education.
So Dana and Janae, thanks for joining us today. Can you tell us exactly what is Medicare? People get confused about what Medicare is and how it can benefit them.
So Medicare is health insurance that's administered by our federal government. Most people will qualify for Medicare at age 65. So about 80% of our Medicare population becomes eligible based on age. The other 20% of Medicare generally qualify because they're determined disabled by the Social Security Administration. And then they have to receive a disability benefit called SSDI, Social Security Disability Insurance, for 24 months. And then on the 25th month, they automatically qualify for Medicare. We also have a population that qualifies based on something called end-stage renal disease, also known as ESRD. And those that have ESRD have permanent kidney failure that requires a regular course of dialysis or kidney transplant. And so they become eligible for Medicare at really any age. This is where we often see children on Medicare due to end-stage renal disease.
So if you don't mind kind of doing a little bit of repeating, just say again, who exactly is eligible for Medicare and at what age?
Yeah, so most people are going to become eligible for Medicare around their 65th birthday. They can enroll into Medicare 3 months prior to their 65th birthday, on the month of their 65th birthday, or even 3 months thereafter. So they have about 7 months to enroll. Some folks can become eligible for Medicare under the age of 65 if they've been receiving their Social Security Disability Insurance, SSDI, for 2 years. Then they can automatically be enrolled into Medicare Part A and Part B. We also see sometimes where folks are under the age of 65 at any age if they have end-stage renal disease. And that's that permanent kidney failure requiring dialysis or kidney transplant. And as Janae said, it is the time that sometimes we see children with it.
So, where do you sign up for Medicare? These people that qualify for it, how do they get signed up for it?
Well, that's a very common question we get here at the Medicare Information Office. I would say that's probably one of the most likely questions we get when helping people by telephone or in person. The Medicare Information Office can certainly provide guidance on this process, but we don't actually complete the enrollment for Medicare Part A, which is hospital insurance, and Part B, the medical insurance. That is handled by our Social Security Administration. Social Security is the agency that's responsible for when you're eligible for Medicare and completing that enrollment. The recommended method is actually if you have access to a computer or smart device and you are able to access the Social Security website online, that is the recommended method, is to apply online for your Medicare A and B through the Social Security Administration website. And that's SSA, just like Social Security Administration, .gov, like government. And then if you actually put in a / and the word Medicare, it'll take you right to that Medicare enrollment button. And the hardest part about enrolling online when you have that internet access is you have to have a My Social Security account created. And you have to log into that Social Security account or create an account before being able to proceed with the Medicare application. And so for many people, that will be the hardest part because you have to answer a series of questions to identify yourself. And you also have to be able to set up that username and password. If for any reason you're unable to access the online website or you don't have access to a computer or trustworthy internet, completely understand that doesn't work for every Alaskan. The alternate option would be to contact Social Security by telephone and schedule a telephone appointment for Social Security to call you at a designated day and time and go through the application by telephone. Many field offices for Social Security also accept walk-ins. We have 3 field offices in Alaska, in Anchorage, in Juneau, and in Fairbanks. However, the Medicare Information Office doesn't recommend that you walk into a Social Security office because you won't have a same-day appointment for a Medicare application. And often applications don't happen for a few weeks out. Often it's like 6 to 8 weeks out for an appointment. So it's not recommended to walk into your local field office, but it is certainly an option if that's what you prefer.
So, do people have to sign up for Medicare?
That is a great question and probably one of the biggest misconceptions with Medicare. There are times that it might not be advantageous for you to enroll into Medicare, even around the age of 65. So if you're working or your spouse is working and they have health insurance through active employment, you can actually defer signing up for Medicare and qualify for what's called a special enrollment period, where you can enroll into Medicare outside of the initial enrollment period that we talked about. It's actually an 8-month-long special enrollment period that you can sign up for Medicare without worrying about that late enrollment penalty. If you're coming up to that age and you have health insurance through active employment, it would be ideal to probably talk with one of us at the Medicare Information Office about exactly how that process would take place. But you don't have to.
So we know that there are several parts to Medicare. We hear Medicare A, Medicare B, C, and D. So without getting too technical, I know that there's a lot of confusions regarding these different Medicare parts. So could Janae, you explain that, please?
Sure. So Medicare's alphabet consists of Part A, which is hospital insurance. And you can think of this like your inpatient benefits. When you're formally admitted to a hospital, it covers skilled nursing facility care. If you leave a hospital and need additional care in a skilled facility, it can cover inpatient skilled nursing facility. It also covers home health care if you need intermittent skilled care at home, and if you need hospice care, which is end of life care, a palliative pain relief of your terminal illness. Part B, the medical portion, that's B like boy, that covers your outpatient services. So if you go to the emergency room, but you're not admitted to the hospital as an inpatient, if you have day surgery, if you need to see your doctor, whether that's your general doctor or a specialist. Part B also covers things like preventive services. If you need your flu shot, it covers durable medical equipment, also known as DME. So maybe you need diabetic testing supplies like a glucose monitor or lancets or testing strips. Lab work, diagnostic services like x-rays, CT scans. Those are all Part B, the medical portion of Medicare. Part C is also known as Medicare Advantage plans, and these are private insurance companies that are overseen and approved by Medicare that take over managing all of the parts of Medicare. So it's a private insurance company that manages your hospital coverage, your medical coverage, and also has prescription benefits usually all rolled into one unit. Alaska hasn't seen these plans available to the general Medicare population, but we still hear lots of commercials about them. And they're very popular because they get to offer additional benefits that our original A and B Medicare doesn't cover. So they can offer things like vision, dental services, eyeglasses, transportation to medical appointments, sometimes even help with food costs. So they're very popular, but we have not seen them in Alaska, and we never know if they're coming back. Part D is prescription drug coverage, and that's when you get a prescription from your doctor that you take to a pharmacy, and you get a medicine that you take home and take on your own. So Part D, also administered by private insurance companies. We do have a lot of different choices in Alaska. And if you ever have any questions about what parts are right for you, what parts you may need or may not need, the Medicare Information Office is here to help you navigate those choices and talk about what might be the best option for you.
I think this is fantastic, having an office where Alaskans can call Alaskans and talk about what they need and get their questions answered. My next question for you is, how much does Medicare cost? And what if I don't have enough money to pay for it?
So that's a really good question. When it comes to Medicare, and as people are looking at retiring, it should be one of the questions of how much does it cost and can I easily afford it? So for most people, Part A is premium free if you've paid into your Medicare taxes or your FICA taxes. Now, Part B, everyone pays a premium for Part B. This year, the premium is about $174.70. And each year, we typically see it go up. So we don't know what it'll be for next year. If you're a higher income earner, meaning on your tax return, your modified adjusted gross income is above a certain threshold, you could pay more for your Part B as in boy premium. That's something we can go over with folks if they're facing that. And then Part D, prescription drug coverage. Should somebody need it, there is a premium for each of the plans, which can really range, and year to year they change. So really, depending on the medications that you take and the pharmacy that you like to use, would determine which of those Part D plans would be best for you. And that's something that we can help with. Now, for folks that don't have enough to pay for their Medicare, they have limited income and resources, there's different programs out there to help with those Medicare costs. There's the Medicare Savings Program, which can help with that Part B as in boy premium. It can also help with the deductible and coinsurance with Part B. For Part D, prescription drug coverage, there's a program called Extra Help. And with this program, it'll not only help cover the monthly premium, but it can cover the deductible. And usually there's just a small cost sharing for medications at the pharmacy. So there's a couple of different programs that can really help folks with their Medicare cost.
So, do you have to enroll in Medicare every year like you do with Medicaid? And maybe since I brought that word up, maybe you might explain the difference between Medicaid and Medicare because people get those terms mixed up very often.
So, with Medicare Part A hospital and Part B medical, that enrollment is not something that has to be done each year. Generally, once you enroll in your what we call original Medicare, the Part A and B, you keep that coverage and it wouldn't end for any reason or need any renewal unless, for example, you didn't pay your Medicare premiums and your coverage got terminated for non-payment. But for the most part, A and B isn't something that people have to annually review or re-enroll. Part D, prescription drug coverage, when somebody has a Part D prescription plan, like Dana said, that can change from year to year. The plan designs can change. The companies offering coverage in Alaska can change from year to year. The plans can change their formulary, which is a list of the medicines that they choose to cover for that year. That can change from one year to the next. Or the pharmacies that they want to work with. That can change as well. So anyone with a Part D prescription drug plan is recommended to review that each year during open enrollment, and that happens October 15th through December 7th. If any changes are made during the open enrollment season, that change takes effect the new year, January 1st. And again, we do recommend that you recheck it each year, even if you've been happy with your coverage, since those plan designs can change, or new companies may change, or your medicine needs may change as well. So it is recommended. And as far as the difference between Medicare and Medicaid, Medicaid is something that is a needs-based program. So Medicaid is for those that have the most limited income and limited resources. Medicaid helps with Medicare costs, so you can actually have both. We call that population our dual eligibles. They have both Medicare and Medicaid. And Medicaid not only helps to pick up costs after Medicare in most cases, but it can also help pay Medicare premiums. Like if you didn't work enough and didn't have 10 years of Medicare FICA taxes, as Dana mentioned, to get hospital Part A premium free. Or everybody pays a Part B medical premium, that $174.70 in 2024, as Dana mentioned. So Medicaid can help with those out-of-pocket costs. And our Medicaid program in Alaska, it can offer additional benefits that original Medicare doesn't offer. So like dental and routine vision benefits. So if somebody has very limited income and resources, you may want to apply for Medicaid, and you can have both and they work well together.
And if I understand correctly, Medicaid is something that's done by the state of Alaska, whereas Medicare is the federal government?
That's correct.
Okay.
The State of Alaska Public Assistance Office is who determines Medicaid eligibility. And if someone wants to apply for Medicaid, they can do a paper application with the Public Assistance Office. And if they need help obtaining that application, the Medicare Information Office can certainly help someone get an application or to apply if they need help completing the public assistance application.
But Medicaid is paid for by the state. And as you said, Janae, the state office of public assistance is the place for that. But it's also paid by the federal government, where Medicare is paid completely by the federal government.
That's correct. Medicaid is federal and state partnership, whereas Medicare is just federal.
Don't go anywhere. We'll be right back.
Before we get to these success stories, Marty, that I know you're going to ask about, there are urban myths out there about Medicare covering long-term care. Can either of you or both of you explain what Medicare covers with long-term care? Because people find themselves in a situation where they might need long-term care and they assume that Medicare will be paying for it.
Yeah, so when it comes to long term care and Medicare, Medicare's typically not going to cover that if we're talking about like an assisted living home, which is what most people are facing with that long term care. Now, Medicare Part A can cover some skilled nursing facilities. So if somebody was an inpatient in the hospital, and maybe they no longer need to be an inpatient, but they're not really ready to go home, Medicare can cover some time in that skilled nursing facility. But typically, the expectation is that it's not going to continue on because they're only going to cover up to 100 days in that skilled nursing facility. So, when it comes to Medicare itself, it's not going to cover the assisted living home and typically those activities of daily living that a lot of folks need from those assisted living homes. So you can purchase long-term care insurance through private insurance. The other option is becoming eligible for Medicaid and having Medicaid pay for that assisted living home if that's what you need.
So, what about supplemental programs for Medicare?
Supplemental programs for Medicare are also called Medigaps, and Medigaps do just as the name says. It covers the gaps left over after Medicare Part A, hospital, and Part B, medical, pay their portions. Medigaps are designed to exclusively shadow what Medicare would pay. So generally, you're buying a supplement plan to help pay out-of-pocket costs that are left over when Medicare covers a service. And there's about 10 different plan designs. They are also identified by alphabet letters, plans A through N. And when somebody's shopping for a supplement plan, it's ideal to buy the plan when you're new to Medicare. So for most people, that's going to be when you turn age 65. Then within the 6 months that you're 65 and your Medicare benefits have started, you have this guaranteed right to buy any policy and you can't be refused because of your age or health conditions. And so if you don't have other insurance like Medicaid or a retirement plan or union plan that would pay after Medicare, and you would like to get a private insurance company that can help with those out-of-pocket Medicare costs, a Medigap policy would then be a good thing to think about, especially when you are new to Medicare, because that's the best time to buy. And there's a great rate guide that our state of Alaska Division of Insurance publishes each year. It is a guide that is housed on our Medicare Information Office website or the Division of Insurance website. If you would like us to email you the link or mail you a copy in the U.S. Postal Mail, we can certainly help you get that guide, which is a great shopping resource to identify the types of supplement plans available in Alaska. But these are only ideal for things that would be covered by Medicare. They are not going to provide assistance with things that Medicare doesn't cover, like long-term care services. They don't offer dental or vision. It is exclusively designed to shadow Medicare A and B. So it's really only going to help with those things that are covered by Medicare. There is one exception, though, and that is that some of the plans come with something called foreign travel emergency. So Medicare usually doesn't cover services outside of the United States or its territories either. So a policy with foreign travel emergency would give a little extra coverage to somebody who was traveling outside of the United States and had a medical emergency within the first 60 days. So that's the one exception. But for the most part, Medicare doesn't cover any services outside of the United States or its territories. But some of these supplement policies can provide a little bit of a benefit on that.
Boy, it can get really, really complicated really quickly, can't it? Yeah. Well, I'm so excited that we're able to record this. And, if people didn't catch it the first time, they can always go back and listen to it again. So I know for myself, I'm getting closer to this age. I'm going to be listening to this again. Now, I know that you guys do what you do because you care about Alaska's seniors and elders. And that's coming across very, very clearly. We can hear your hearts. Can you tell us some of your favorite success stories?
Yeah, absolutely. So this is probably our favorite part of the job is these success stories that we get to go home and feel like are a really big win. So I talked a little bit earlier about the Extra Help program, which helps with prescription drug coverage. I was working with an individual a couple years ago, and they had been qualified for partial extra help, which meant they still had to pay about 15% of the cost of their medication. And this individual happened to be on a very expensive medication. It came out to about $600 a month at that 15%. And so it was completely unaffordable for the individual. And so they came to me kind of at their wits' end. I don't know what to do. I need this medication. And so we actually went and found what's called a prescription assistance program. And that's a manufacturer program that can help with the cost of those very expensive medications. And so we completed the application and we got their provider, their prescriber involved, and they helped fill out the application. And we sent it in. And so the individual called me back not too long thereafter, stating not only were they approved for it, but the medication was being delivered to their home at no additional cost to them. And that was such a huge win for somebody that wasn't able to afford their medication. So even if you're just feeling like your medication costs are too high, there may be other programs that we haven't even mentioned today that we could help connect with. And so that one was just one of my favorite wins. How about you, Miss Janae?
So for me, every phone call that's encountered at the Medicare Information Office is a success story because ultimately that person is finding out who we are and we're helping them to make informed decisions about health insurance and health care and making them empowered consumers to be able to ask good questions about when something is covered and to prepare for upcoming costs. But probably my favorite recent story is a person who had applied for Medicare and the application didn't happen as it was supposed to. And when the application isn't done timely with Medicare, it can result in a later start date for Medicare and also late enrollment penalties, a higher cost on your Medicare for not signing up when first eligible. And this was actually a mistake that was made because the original date of filing wasn't truly recognized as it should have been. And so, with a lot of helpful partnership, since the Medicare Information Office is a state based agency in the Department of Health, we don't actually process the applications for Medicare. But we're very fortunate to have partnerships with the federal agencies responsible for Medicare. So we've been able to build a rapport with the Social Security Administration, the agency that is responsible for Medicare applications. And we were able to work with their public affairs office to bring to their attention that the application date that was originally done wasn't recognized. And when the federal government makes a mistake, they have to correct that mistake. It's called equitable relief. And so we went through the process of requesting equitable relief. And we were also able to get Social Security to recognize that the original application date wasn't honored. And so they went back and corrected their mistake. And this resulted in the person not only getting their true effective date that they needed when they turned 65, and were able to go back and get coverage for some hospital services that they had incurred when the Medicare hadn't been in effect as it should have been. So for me, that was a very large success because that meant things were processed correctly and the coverage was in place when the person needed it the most.
They didn't end up getting penalized in the end because of someone else's mistake. That's great.
That's right.
Yeah.
And that's a lot of why we want to encourage people to understand who the Medicare Information Office is so that those questions don't go unasked, and people know that there's a resource here in Alaska that can help them navigate what sometimes can be very complex and difficult and frustrating. So we want to take the maze out of Medicare by helping people understand and ask those good questions.
So where can our listeners get more information about Medicare?
Great question. So they're more than welcome to go to our website, which is medicare.alaska.gov. On there, we have what's called our calendar of events that goes over when we're doing outreach and education. So each month we hold a Medicare 101 in the evening from 5:30 to 7 p.m. So for those that work, hopefully they can still attend. It's a Zoom event. And we go over the basics of Medicare. We talk for about an hour, and then we leave 30 minutes for question and answer at the end. The other thing you can do is call us at the Medicare Information Office. You can call us toll free with a 907 telephone number at 1-800-478-6065. Or you can call us at 907-269-3680. You'll reach our front desk, Teresa. We are very proud of answering the phone Monday through Friday, 8 a.m. to 5 p.m. But should we be on another line or in a training, please leave a message. It's a confidential voicemail. And then what Teresa does is she actually puts callers into a call queue so that our certified Medicare counselors throughout Alaska can call and provide that Medicare information. So it might be one of us here from the Medicare Information Office. It could be one of the grantees that we have, or it could just be a volunteer Medicare counselor that out of the goodness of their heart dedicate their time and energy to helping folks understand Medicare.
Now, I heard somewhere that there's a book called Medicare and You. How do people get a hold of that?
It's a great question. So Medicare and You is actually mailed to every Medicare household in the fall. Usually goes out in September. Most Alaskans receive it probably late September, early October. You can also go online to medicare.gov and pull up a Medicare and You handbook. And that handbook is very handy as it's going to go over not only the different Part D plans in your area, but also how Medicare covers and if there's changes. That's why it's sent each year. The other thing you can do is give us a call. We keep extras on hand, so we would be happy to send one out.
So I heard you say the Medicare office and you have volunteers across the state. I know senior centers, that was my background, have Medicare counselors as well. They're trained by either one of you, and how does that work?
So the Medicare Information Office is funded by federal grants to do this work. And each of our grants also requires that we recruit and train counselors that can help people navigate Medicare questions. So the Medicare Information Office, when someone is interested in volunteering, we have many different volunteer roles. We have volunteers that help at health fairs by doing outreach in the community. For example, we'll be at the Alaska State Fair. We have a booth there each year to provide outreach. And some of our volunteers provide outreach by handing out publications about our office. And then when more in-depth Medicare questions come up, they can refer people to the Medicare Information Office staff or their trained counselors. We also have volunteers that become full Medicare counselors, and there's a series of Medicare modules that the person has to go through to learn. Those modules are available online. They're a self-paced, self-studied course. And then we follow up with mentoring by some of our Medicare counselors that have been with the program for some time. And so there's both a training online and a mentoring process to become a certified Medicare counselor. We also have an ambassador program. Ambassadors are community agencies that have, for example, as you mentioned, senior centers, aging and disability resource centers, pharmacies, Those kinds of places, they have the Medicare population coming to them and seeking information, but they may not have the staff or the time to become a full certified Medicare counselor. Our ambassadors are wonderful partners that connect people with basic information about Medicare. But then again, those more in-depth questions get referred to our certified Medicare counselors, either here at the Anchorage Call Center or another Medicare counseling site. Like Dana mentioned, we have grantee agencies. If someone is interested in volunteering or becoming a Medicare Information Office ambassador, you can call or email us. We have a training that you can go through. It's just a very quick what to do and how to do it. It roughly takes like 5 to 15 minutes to find out how to become an ambassador or a volunteer and see if it's a right fit for you. And then we can set you up with any necessary training. And again, our phone number, 907-269-3680. Or our email address is hss, like Health Social Service, .medicare@alaska.gov, like government. So if you have any interest in volunteering or becoming an ambassador, reach out to us and we'll talk more with you about those opportunities.
Well, thanks so much for being with us today. I have learned just an absolute ton that's going to benefit me in the future. And I appreciate you guys accruing all of this knowledge and being willing to share it so generously with our listeners. Thank you so much for being with us today. We appreciate what you do. Your heart comes through. And wow, what a great service you're providing to the seniors of Alaska. Thank you.
Thank you both.
Thank you for having us. Really, getting the information out there and sharing it on a platform like this just helps us get what we're trying to get out there. So thank you for the invitation. What a wonderful avenue to be here and talk with you guys today.
Yes, thank you very much. And thank you to our listeners for the opportunity to empower you with Medicare information. We look forward to hearing from you if you have additional questions.
So now it's time for Pat's Points. Pat has been working on behalf of Alaska's seniors for more than 35 years. And in that time, she has gained a lot of knowledge and wisdom. So, Pat, what did you find notable in our conversation today?
Well, that Medicare can be complicated, but there is assistance for everyone about those obstacles in getting on Medicare and when you do it at the state level, as well as at senior centers. There are Medicare counselors as well who have been trained by the state gurus on Medicare as well. So there's a lot to learn about Medicare.
Yeah.
And what comes out every year is a book for people who have signed up for Medicare. And I just got mine in the mail the other day. It's called Medicare 2025, which answers a lot of questions. But the two gurus at Medicare at the state level had lots of points to be made regarding this system.
Yeah. What struck me is just the depth of knowledge that they had and their ability to communicate that to people clearly and precisely.
So there is help at the state level. There's also help at the Social Security Administration website when to apply. And usually it's 3 months before your 65th birthday, although there are other criteria for getting on Medicare before that. And it's a federal program, and it's a different program, the Medicaid,
Right.
which is an income-based state and federal program. So oftentimes, well, we think of Medicare as health insurance paid by the federal government that covers usually about 80% of your bills on Part A. And then you sign up for Part B as well. That's really important to have that as well. And then there are other options as well with C and D, A being the hospital inpatient program, B being the medical or outpatient program, C is the Advantage, Medicare Advantage, which we do not have in Alaska, And then D, the prescription drug program. And I think what gets confusing for people, what I've seen the most, is that if they have insurance through their employer or the state, how does that interplay with signing up for Medicare?
Right.
I think that's one of the biggest questions that need to be answered by a Medicare counselor because it gets complicated.
So instead of Alaskans needing to know their ABCs, it sounds like when it comes to Medicare, people need to know their ABDs in Alaska.
That's right. We're skipping the C in Alaska.
We have plenty of C.
Yeah, we have
It's all around us.
That's a good point. I think the other point that needs to be made from my experience in having Medicare questions answered is that people also assume that Medicare covers long-term care, and it does not. It's only when you're rehabbing from being in a hospital stay, and for 100 days that would cover a situation of being in a long-term care rehab. So there are lots of misunderstandings in what Medicare covers. And should I take Medicare B and pay for it? My advice, as our counselors indicated, it's really important to have both coverages. Even though you might have to pay for B, you will have to pay for B depending on your income. But it is well worth it because you want to be covered by any hospital inpatient or B through any medical outpatient that you pay for.
Right.
So I think those are the points I would like to point out. But again, we have in this state Medicare counselors who are trained at the state level and at the local levels as well through senior centers, independent living centers, or ADRCs. So those are my high points. And knowing that there's help, don't be afraid to ask for it because it can be complicated.
Yeah, and it sounds like if you have any questions, they just want you to call them and get your questions answered straight from the source.
And both of the counselors that we spoke to at the state level had wonderful success stories. They know what they're doing, and they can be trusted in giving you the right advice.
And we want our listeners to have those same success stories. So please, if you have any questions about Medicare, please call the folks at the Medicare Information Office. That number is 1-800-478-6065.
And if you have questions about Medicaid, you go to the State Office of Public Assistance. That's separate.
You know, when experts like Janae and Dana explain Medicare, it doesn't seem so complicated, does it? So, if you need help getting signed up for Medicare, or if you have questions, don't hesitate to call the Medicare Information Office. Do you have a pen and paper ready? Their number is 907-269-3680. Again, 907-269-3680. As you can tell from this program, they would be happy to speak with you. Let me give you that number one more time, 907-269-3680. We hope our program has helped you. If it has, please tell a friend to listen to Alaska Wisdom and Wellness. Alaska Wisdom and Wellness is a production of the Alaska Commission on Aging. Our theme music, High Clover, was provided by Audio Hero and downloaded from www.videvo.net. Today's program was edited by yours truly, Marty Lang, who is also your host, along with Pat Branson. Thanks for listening.